Hello and welcome to another episode of So What Do You Actually Do? Today we have Heather. Heather studied plant pathology and worked at the Mayo Clinic as a clinical lab technologist. Soon after that, she explored a field which I haven't heard of before, embryology. Please stay at this episode and watch till the end as she describes what the work is in the lab, work-life balance, and the pay. Please also check out Heather's account in the notes below. She has more interesting takes on her job and other interesting aspects of her life. Please don't forget to like, subscribe, and share.
Hi, yeah, thank you so much for having me. When I saw that DM, I thought it would be a great opportunity to talk about my career to help people out there interested. But yeah, I am an embryologist.
So if you can describe to me where in general, like if you can just put the umbrella of the lab, and where does Heather fit into the structure of the company or the lab? So just so people can know, like, okay, this is the structure and this is where you contribute to that structure.
Okay, so I guess our clinic works as like we have the lab, which is me, and then we have like the clinic side, which is where like your doctors, nurses, anesthesiologists, like we work together, but we're separate.
Mhm.
So with the embryology lab, I don't know if every lab works like this, but there's 3 tiers of embryologists. There's me, I'm a junior embryologist or embryologist one. So I'm coming in with a little bit of work experience, but no previous embryology experience. And with the whole embryology realm, you just have to get signed off on specific things. And then once you get signed off on ICSI, so ICSI stands for intracytoplasmic sperm injection, and that's like where you're actually injecting the sperm into the egg to
Mhm.
promote an embryo forming, right? So that step is once you are signed off on that, then you become an embryologist two in my lab. And then an embryologist three, that's when you are signed off on biopsy. So biopsy is the genetic testing. And pretty much when you're an embryologist three, you are super valuable and you can go anywhere you want. And honestly, embryologist two, once you know ICSI, you are really valuable. Like if you look on any embryology job posting, they want you to know ICSI and they're willing to pay you for that. So,
Cool.
yes.
Nice. Can you please explain embryologist one, and if you can break it down also into, so what do you do on a daily basis, and what is it exactly that you do when you kind of come in and like this, these are the set of skills that you have to interact with, or not you interact, the set of skills that you have to utilize, and these are the procedures. You don't have to dwell too much in detail, but like in general, just so people have an idea of, okay, as an embryologist one, I just entered the field. What is
Mhm.
it that I'm doing?
Okay, so like I said, I've only been here for 6 months, and the first thing I learned was sperm analysis. So, um, I guess so sperm analysis, you're literally looking at the specimen under the microscope and we do a count. So some like technical skills you have to know or like that you learn is, how to work the microscope and then how to use a pipette. But that's all
Mhm.
skills that you can learn in college too. But like when I first started, I was in the sperm room most of the time. I'm doing
Okay.
sperm analysis. And, a lot of the times, um, the samples are completely fine. Other times, like there's super low counts, and it takes like a senior embryologist to find some sperm. They also have to we do TESSAs, which it stands for testicular sperm aspiration. And that's pretty much where the male can't produce any semen, or like any sperm, so they have to go under anesthesia. A little part of like the testicle is cut out. And then
Mhm.
us as an embryologist we will process that tissue, like chop up the tissue, look at it under a microscope, and hopefully find some sperm in there that we can use to ICSI to make embryos. So I learned that right away too, which was kind of, what's the word? Intimidating, because you're like in there with the doctors and nurses and patient, everything. But, and then we also, what I do on a day-to-day basis is dishes. So every day, this might sound so like simple or like what, but we make dishes every day for the eggs and the sperm and everything, for the embryo transfers, egg retrievals. We have specific kinds of media that they have to go in while they incubate and just, before they're used. So we make dishes every single day, and I'm pretty sure every embryology lab makes their own dishes like the day of or day before. So that's something that's kind of just like the grunt work that embryologist ones, like, you just have to do. It's like one of the things that might not be as fun or interesting, but we just have to do it every day. So yeah, but then I also just got signed off on egg retrievals, which is I actually really enjoy. So I'm in the OR with the patient, doctor, nurses. The patient goes under anesthesia, and that's where the doctor's literally taking a needle and collecting the eggs, and I look for the eggs under the microscope, and I collect them. We put them in to incubate for a little bit before we ICSI. So yeah, and now I'm about to be signed off on embryo thawing. So most of the embryos, after we ICSI, the embryos develop for 5 to 7 days. And most of the time we end up freezing them. And then whatever works for the patient to come back to get a transfer, we don't deal with that. But so pretty much we end up having to thaw, we have to thaw, and I'm learning that. So hopefully I'll get signed off on that in like a week or two. But that's like the next step I'm on. And there's like a few more steps I have to learn before I become embryologist too. And that is like day checks and I think freezing and something else. I don't remember. But yeah, that's kind of like the gist. I'm doing either sperm or egg retrievals every day, and then I always do dishes. So yes.
But on the topic of money, how much does an embryologist normally, in like average range, very generic range?
Okay, so if you're going into a lab straight out of school with no experience, I think my lab, their pay range is between like 60 and 65K. Well, so I get paid a little bit more with my experience and with my master's degree. That's the other thing. If you have a master's degree, you'll probably get paid a little bit more versus just a bachelor's. And then, so what I was told was when I become an embryologist too, I will get between a $10,000 and $20,000 pay increase. So I'm hoping to get signed off on ICSI I'm hoping to be an embryologist too by this time next year. However, 10 to 20K, like that's a huge like range, right? Um, and then embryologist 3, like you can easily make 100K. So, and onwards, like I've looked at job postings, and there's even just like normal embryologist postings like on the West Coast that are paying like 120. So, but that's also like California.
Yeah.
So that's like expensive. But, I've seen sign-on bonuses too. There's, like I said, it's like a scarce job. People are always hiring and they're willing to pay.
So it roughly takes, let's say, 4 years before someone reaches an embryologist three, roughly three, four
So
years.
So this depends. With my lab, because we're so busy, we I could probably become an embryologist 3 in like 3 years. Yeah,
I
4 for
see.
sure. But other labs where they have lower caseload, like the 300 cases a year, that like less cases means less experience and less opportunity to learn. So someone who's at a lab with 300 or 500 cases a year, it might take them, if they stay in that lab, it might take them like 5 or 6 years to get signed off, unless they like actually be intentional about training every single day. But if you only have 5 cases a week versus we have 5 to 10 cases a day, like it's easy for us to train.
Yeah.
So yeah. So that to answer your question, it honestly just depends on the lab. So the lab I'm in is really good for training, but once I'm signed off on everything, like I want to go to a more chill lab.
Okay.
So that's the goal.
Nice. Go through the trenches in the beginning and then get relax after that.
Yes, exactly.
Last question. We have a couple of minutes left. What is a piece of advice that you would give someone who is interested into embryology early on in their career, or slash thinking about embryology?
Okay, I guess can I like say the different tracks you could go to?
Yeah.
I guess. Okay. Okay, so if you're in high school or college thinking about embryology, the basis, like the thing that you need the most is an undergrad. I would recommend maybe getting your MLS certification too. And I know that's like medical lab science, because I know some states you do, like Florida, you have like I can't get a job in Florida because I don't have my MLS. So getting your MLS certification would be like prime for you to like get or for would be good.
Thrive.
Yes. So bachelor's, and then your options are you can just go straight into the workforce, and the easiest way to get or the easiest way to become an embryologist is to start in an embryology lab, which is like the sperm side of things, and work your way up, because you can work as an embryologist for 2 years, and with that experience, like you could easily get hired on as an embryologist. That happened with some of my coworkers. Literally, yeah. So the other option you could do is bachelor's and then go to grad school and get your I mean, like me, I have a degree, I have a master's in plant pathology, but if you actually want to like go into like you could go into like human development, get a master's in fertility, yes, or like something like that. I don't know like what other, yeah, human development or
Okay.
medical, something medical. Also, and then after you get your master's, then you can go directly into an embryologist job. But again, you have to find a job that is willing to train you, which might be difficult. But that's kind of like the two different routes you could take.
Well, we have come towards the end of the episode. Thank you so much, Heather, for giving us your time and your expertise on embryology. To be honest, I didn't really know this field existed in this kind of depth and need, and to that extent of like, the career path that someone can take. Um, so is there anything you'd like to end on for today?
Thank you so much for having me. I enjoyed our conversation. And I guess the only thing I have to say is if you're thinking about embryology, just do it. So it's a good field to be in for sure. I've enjoyed it so far. But
Nice.
yeah, thank you so much.
Thank you so much.